Hand washing. First you need to wet hands and apply soap. Rub palm to palm and interlace fingers. Rub the backs of fingers and thumbs, as well as nails to palms and lower arm. Rinse hands and dry with towel. Try not to use the same bit of towel on each hand. The duration of hand washing should be between 40 to 60 seconds.
Temperature. It may be a good idea to sit the patient down. Check the patient's ear passage and make sure it's clear and there's no build-up of wax. Before using the tympanic ear thermometer, ensure a disposable cover is on it before placing it in the patient's ear. Ensure you do not force the thermometer into the patient's ear. Put it gently in without any irritation to the patient. Once it's in place, activate the tympanic thermometer by pressing the button on the back of it. Keep it placed in the ear canal until you hear a beep, which means it's finished. Remove it from the ear and read the reading within 2 to 3 seconds of the beeping to obtain the results.
Blood pressure. First, sit the patient down. Ensure the patient's arm is resting on a pillow so their arm is at heart level. Place the sphygmometer within a metre of the patient and ensure it is at eye level of the patient. Palpate the radial artery to find pulse. Then apply a cuff over patient's bicep and make sure that the cuff is in the correct line with the brachial artery. Ensure the cuff is placed so it takes up 2/3 of the patient's arm and that it is also comfortable for the patient. Once the cuff is secured, find the radial pulse once again. Begin to inflate and palpate for pulse obliteration to get the estimated systolic beat. Once estimated systolic beat is found, deflate cuff and place stethoscope. Inflate approximately 20 to 30 millimeters of mercury above estimated systolic BP. Deflate the cuff at a rate of 2 to 3 millimeters per second. Record the systolic BP to the nearest 2 millimeters when a regular tapping sound is heard, the first stage of Caricos sounds. Record the diastolic BP to the nearest 2 millimeters when sound disappears, the fourth stage of the Caricos sounds. Then record your findings.
Respiration and pulse. First ask the patient to sit or lie down so they are nice and relaxed. Get them to rest their arm on a lap or on the side of their hand pronated. To find the radial pulse, use both your index finger and middle finger. Place the pads of 2 fingers into the groove below the radius. Lightly palpate the skin until you find the pulse wave. Once the radial pulse is located, count the pulse for a period of 30 seconds. Once done, times the counted beats by 2 to sustain the beats per minute. If pulse seems to be irregular, for accurate results, continue counting for another 30 seconds to ensure accurate readings. Whilst taking a pulse, you should access it for rate, rhythm and strength. Document your observations. Once the BPM has been measured, continue to hold the patient's wrist and sit for another 20 seconds, counting the patient's respirations. A full respirations is measured as 1 complete inspiration and expiration,